Good morning, my good friends. I have extremely good information that I'm not sure is widely known yet. They did randomized controlled trial validating the use of this paraspinal Entericet to reduce post-stroke disability and found that it has wide-ranging implications, not only for post-stroke, which means the effects of a stroke, debilitating effects. You can't talk, you can't walk, all kinds of things, and also Alzheimer's. They found this particular treatment works for, and literally almost instantly. This talks about the way this passes the blood-brain barrier. Very important. And they did 629 patients they tested, and then they did Alzheimer's, all kinds of things, and it seems to work quite well, as I will show you. Okay, my friends, do you know anybody that's got Alzheimer's or has had a stroke? This is from the Institute of Neurological Recovery 6 years ago. Now watch this. This is a stroke person that is about to get a treatment. Just like that, she's cured. It also works for Alzheimer's. There's just been released a paper a few months back that says, yes, it works. Now watch this.
Can you please count from 1 to 10?
All right, there's no sense to go further on that. No, she had a bit of trouble walking, but not terribly. But this is reading a word list before the treatment.
Please read this list of words.
I don't see any need to go any further. All right, this is 4 minutes after they gave her the shot into her blood-brain barrier.
Oh my!
20 minutes.
It's clear here.
20 minutes.
And here is clear.
It would have taken her 10 minutes to get out that sentence before. It's 20 minutes.
Amazing.
This is unbelievable. Unbelievable. If you know anybody that's had a stroke or has Alzheimer's, this can be done within 10 minutes, 20 minutes, a half hour. This is unbelievable. Now this is only 30 minutes after getting the shot, and you saw what she was like before, reading numbers and reading words.
Can you count? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
It's not bad. 40 minutes after the dose. She's going to do some reading.
Can you please read this list of words, starting from the top, out loud? Go ahead. Cube, cluster, mistake, machine, learning, ladder, practice, playful, reading, radio, student.
That's about all we need to see there.
I'm so thrilled, and I just keep thinking of my granddaughter Juliana, and how she always wants to play teacher, and well, Mammy, someday maybe you'll teach again. Maybe you'll get normal again. Maybe you'll get fixed, and maybe you'll be able to teach again. And as I looked at that, I thought, there I am in my I look like a teacher, I sound like a teacher, there I am in my teacher role again.
This is just unbelievable. Now I'm just going to go back from the bottom up here. It talks about all these different substances and all these different afflictions and the terms that they use and the publications where they were and the references, and then all the different studies that they did on this, and these cited studies. And they did this selective TNF inhibition, chronic stroke, traumatic brain injury, observational study, 629 patients. And it was all good results. They were very quick, and even 10 years after they had had their stroke, it was still effective. Okay, I guess I should throw this in. This was a paper, was received on October 2010, revised 2011, accepted August 2011 for scientific publication. Now, this is all the backup and the documentation. They did it very, 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 very well. And the conclusion was that clinical improvement following paraspinal administration of Intercept in patients with Alzheimer's. We know it works in strokes, and Alzheimer's disease and other forms of dementia, stroke, and brain dysfunction is characteristically evident within minutes. And that's all traumatic brain injuries. If once you get the clot in your head, apparently, which is, in my feeling, it's from fibers, basically blood, like scabs. They turn into, boy, I can't even think of the words now. They turn into scars. So you got the scar tissue. Oh man, I think I got some scar tissue on my brain. And once that scar tissue sets in, it's all over. You can't get rid of it. It's too big to get out of your blood-brain barrier, apparently. And when you hit it with this enzyme, it just blows it out, because enzymes work, what they do in less than the time it takes you to click your fingers, it would take 100 years to do that same chemistry in nature. I'm serious. So this is a very important, and they say right here, this was well done, and this was 10 years. This goes back to, 2012, 8 years ago. And they say, in science, it's not unusual for unexpected result to be dismissed as an aberration, mistake, or a misinterpretation, particularly if unexpected result presents a challenge to an existing scientific paradigm. And that's exactly what's happened. When they're told to speak one way and they start speaking about something in a different way against the mainstream, they're done. That's the problem with our system now. In all of education, medicine, the whole 9 yards. You speak up and they crush you. It's just not right.